Hello everyone, and welcome to a physical therapy case presentation on a child with EDS. I'm Patty Stott, and I'm located outside of the Denver metro area, Colorado, and also provide telehealth services. I'm primarily a physical therapist, but I also have a background in athletic training, hand therapy, functional medicine, and herbalism. I work with patients of all ages with connective tissue disorders from a physical therapy or a health and wellness standpoint. I don't have any conflicts of interest in all photos that were used in this presentation. We have patient and parent permission. So this is the outline of the child I'm going to discuss today. This particular case is actually over the course of a few years, but I wanted to provide a look into what we might see with a child with hypermobile EDS over time and what some different physical therapy approaches might look like, even with children. This particular individual had a few unique presentations to talk about as well. Interestingly, this individual doesn't necessarily present like a stereotypical child with EDS. She looks a bit tight in her muscles, so she doesn't have the hyperflexibility, but her joints do like to sublux, which is where we're running into some problems. Not only has she had a number of hip and patella or kneecap subluxations, she's also had a number of left ankle injuries with multiple sprains in a short period of time. As a younger child, she had a bilateral hernia repair, so lower part of the abdomen, sensory integration issues, rashes, verbal apraxia, abnormal blood tests, and some other skin reactive issues. More recently, she's been presenting with complaints of dizziness, anxiety, heart palpitations, and other things that are suspicious with the onset of dysautonomia. She does participate in recreational activities like seasonal swimming, non-competitive gymnastics, yoga with her parents, and sometimes she does walking on the treadmill. She recently told us that she wanted to participate in a cross-country club next year, so running at the school. And she has been having issues with energy conservation and increased overall fatigue. Her anxiety has been getting in the way of participation in some social activities and school activities. She's had good support and participation in activities with her parents. And as it progressed through her case, we're actually going to start when she was a bit younger and eventually come to where she is today, which is about 10 and a half, but we started when she was 8. So this is the general overview of what we've seen her for in the past. So we're going to go over the general overview, and then we're going to break this up a little bit separately so we can see how we overall managed each of these things that she saw us for. So her first visit to physical therapy was in 2019 when she was 8, and that was after 2 ankle sprains on the left, 2 left hip subluxations, and 1 left patellar or kneecap dislocation. She was having balance issues and control on the left leg that was affecting participation in sports and feeding into some further issues with stability on that leg. She was also eventually found to have a venous malformation in the left ankle in the summer of 2019, which we'll discuss. In 2020, she experienced severe recurring abdominal pain that she eventually came in for. And currently we're dealing with head and neck pain along with dysautonomia and general activity intolerance. So we're going to break apart each of her times that she came into physical therapy and just have a brief review on what each phase looked like. All right, so rewinding back to 2019 when she was 8 and she first came in to see me, she had generalized left leg weakness. She did have that history of 2 left hip subluxations, 1 kneecap subluxation on this side the year before during a growth spurt, and she also had 2 bad ankle sprains in 2018. And since then, she's had lingering swelling that was happening in the front of the ankle that would decrease that would increase when they were climbing to altitude. So it would swell up when they go up in elevation. And you can see it a little bit there in the picture, our right side, which is her left, that puffiness that's happening in the front of the ankle. And this approach that we did with her in 2019, this is really what we consider like a standard physical therapy approach for her orthopedic issues, because that's what she was presenting with at the time. We tried some kinesiotaping for the ankle swelling, and she did tolerate that well without any skin reactions, but it didn't seem to change her swelling. We did about 3 months of physical therapy, focusing on balance and proprioception activities on that left leg. In the beginning, she performed strengthening of her ankle and hip with TheraBand activities at home. She performed strengthening for the ankle in all 4 planes, so our up, down, in, and out. Her hip exercises focus on strengthening of the gluteus medius muscles to help balance and stabilize on one leg. She performed clamshells and sidestepping with the band in office and also at home in the beginning especially. And then she did much more functional balance and proprioceptive work with her yoga and balance activities at home as well. Sometimes she would use a mirror for feedback to be sure that her hips were even with one of her balance activities, which I'll show just an example of. We did a good deal of manual alignment work through the pelvis, through the hip, through the ankle on that left side, because with the imbalances, she was the muscle imbalances from the subluxations and the weakness that she had developed, she had a lot of alignment issues. So we did have to align her up first, and then we progressed into strengthening. Her parents kept up that balance work at home, and they did yoga activities because she would do that without too much convincing. She had really good improvements over time of her balance and strength in the left leg, but that swelling remained. So she eventually went out for an MRI, and a vascular anomaly was found and confirmed with ultrasound. So there was a curiosity if that could be actually feeding into also some of the leg weakness with possibly abnormal blood flow. So that isn't fully out of the question, but she's still being monitored for that today. So this is just an example of the strengthening exercise she performed in office and also did at home. Again, these are kind of our standard physical therapy ones that we started with, some for strengthening. She performed the ankle TheraBand exercises for strengthening of the ankle, that top left corner, so up, down, in, and out. She did clamshells, which is that middle top picture. She did sidestepping as well with the band around her knees within the clinic, and she actually did like to do that one at home too. She did some balancing work in clinic that she used the rocker board for, and the BAPS board. When she was at home, she would use a pillow, or she'd use the cushion of her couch to work on some balance when we got to that point that she could do that. The bottom middle picture was something that we worked on quite a lot with her, and this was keeping the hips even when she was standing. So this is where she would use the mirror for feedback in the clinic and also at home sometimes. And what she's trying to do is that green figure there and keep the hips even. So the bones on the front of the pelvis there, you can use those for watching alignment. And she tried not to let it drop, which is what you're seeing in the picture on the right. She performed all of these about 3 times a week, so in clinic and also at home. And she kept them up for about 3 months. And after the 3 months, her strength was functionally really good. The muscle imbalances were improved. She was maintaining her alignment on her own. And then we faded off into a more functional strengthening program with her activities. Now she works on the yoga poses with her parents, and she does some extra work when she's in gymnastics class on the left leg. So she'll just warm up a little bit of balance on the one leg, or some exercises on it on the one leg to make sure that she checks in with it before she participates. So she's still being monitored for the venous malformation. She's keeping up a lot of her strategies for this. She typically wears a thigh-high compression stocking when she's in vertical for activities or up for prolonged periods of time. She might wear a compression ankle support for sports activities, and they're just going to continue to monitor this as she continues to grow to make sure that it doesn't grow with her. She still keeps up those balance activities with yoga practice with her parents a few times a week. She focuses on single leg standing postures. She hasn't had a subluxation on that left side or pain in the knee or hip since 2019. So she was discharged from our care at that time, and then returned a little bit later. So after about a year off performing her own activities, she came back with complaints of severe abdominal pain that wasn't improving with her medical management that they had already tried. It was narrowed down to a mast cell reaction within the gut, which was what her diagnosis was. She was having severe UTI-like symptoms, but all of her testing would come back negative. She was on cyproheptadine after a few other trial medications, and this was used for about 6 months, and it did actually allow her to sleep, but it didn't change the pain patterns that she had. So since it didn't change the pain patterns, they did switch her just to a supplement form of quercetin, which she responded actually very similarly to. And then they referred her out to manual therapy with me for a trial, because I also perform visceral manipulation, which is work on the organs. When she came in, by the end of every day, she would still be pacing the house. So she was unable to sit still or sleep from the pain that she was having. And this was primarily, she would point to her belly button and down lower, a little bit up higher, but it was typically belly button and lower. And this was going on for many, many months. Again, this typically progressed throughout the day for her. In our evaluation, we did find that she had issues with restrictions and functions at her stomach, the small intestine, and the bladder. We worked very gently on movement and alignment of these particular organs within our session. After the second session, where we really focused on gentle bladder work, she had no episodes of pacing the floor, and she has not had a UTI-like episode since then as well. And her UTI-like episodes were happening at least a few times a year since she was a toddler. And we are seeing her now, and she has not had them in the past 2 years. So pretty significant, coincidental timeline perhaps, but it was, pretty much the day after we had that bladder session that she has been having a significant decrease in her pain and reactions. So we were curious if there might have been some residual adhesions from her hernia repair that might have influenced her bladder function and positioning, because connective tissue. Interestingly, after all of this, she still had some upper gastrointestinal pain that came to light. So real stomach pain. It was minimal, but it was still present. But she was functional. She was doing really well. So at that time, we had discharged her, and over time, she actually had more relief in this area when she started working on mental health for anxiety, and directly with work on her upper cervical spine as well that we're addressing now. And for those unfamiliar with visceral manipulation, it's a very gentle technique that works on the organs and the soft tissue that's associated with them to improve alignment and function. So the picture on the left demonstrates about how much pressure is generally used, and it's very, very light. The picture on the right is more of a specific example of what was done for her bladder in very minimal manual techniques. So it's all external, but very, very minimal engagement and then movement of the structures. And with visceral manipulation, the techniques really follow the restriction of the body, and it doesn't necessarily stretch against anything. So it's a very gentle osteopathic approach, but this works significantly for her in just the 2 sessions. And then this brings us to our current treatments when she's returned this year with chronic headaches and neck pain and stomach pain, but that was just kind of a bonus of treating for the neck issue that we saw her for. So her abdominal issues are under control. There's some lingering stomach pains that are related to anxiety, and a lot of times also her food choices, because she does have a lot of food sensitivities. And she's keeping up her balance activities with her leg, and she tries to keep up activities with body awareness, such as the gymnastics, yoga, and swimming. So she's been doing very well. She does have accommodations at school that give her more breaks if needed, so less screen time, and horizontal breaks as well if she needs them, but she was still developing headaches by the end of almost every day. So we had her come into clinic to figure out if this was potentially something orthopedic or something that we could help as well. And we did find that she had a rotation of that first cervical vertebrae, so the one just underneath the head, and she did have alignment issues there. We've been gently working on alignment in clinic manually and also through some muscle energy techniques. We use eye movement to help guide the upper cervical vertebrae back into place. And she was taught how to do this on her own as well. How you move this is really dependent on the position that the rotation is happening for the individual. So it's going to potentially be different with every patient as to how to use this technique. So it needs to be evaluated by somebody that specializes in upper cervical spine and instability. She's also working on upper cervical proprioception with the head laser. Currently, she's just trying to maintain a neutral position while we're moving the arms. This is actually very difficult for her to do right now, but she's finding some relief with it already, and just doing the exercise for the short amount of time that she does it. And she uses it with her cats for extra entertainment while trying to keep her head steady as well. So here are the examples of the main things that have helped her with this, with the headache and upper cervical piece. The first 2 pictures are of her using an object on the wall. So it's actually a cat shelf that we just found it was the perfect height for her at home, and she loves to use it with the cats. And she uses that to focus the head laser right in the center of that circle. She's currently working on arm movement only, so the laser has to stay in one place on that circle, and she'll lift one arm slowly and then lower it all the way back down before she switches to the other side, while she's trying to not let that laser dot move on the circle. She's only doing this for a 2-minute timer count. We started at 1 minute. She's been doing this for about 2 weeks or so. And she's doing very well with it, but this is just a very slow progression because she does have difficulty maintaining that spot in the center of the circle. The picture on the far right is of the eye movement technique. With her, she had a right rotation, so this picture is specifically showing how we taught her to work on that rotation. And it works on the movement of that C1, so the vertebrae just below the skull. And with this, you want to keep your head still, and the fingers go on the wings of the vertebrae that sit under the ear. And then you gently turn the eyes to however the specialist has figured out is the right rotation to put things back into place. But she's turning her eyes to the left in a pain-free range for a few seconds. And she repeats this about 5 times in a row. This is specific to her anatomy, this certain way that we're going. And the technique should only be discussed with a physical therapist special for any other individuals. The fingers do not push on the bones. They only follow gently in a much more gentle osteopathic approach. But these are 2 things that are actually great for upper cervical instability as a non-invasive and a very gentle treatment strategy. So during this recent episode that we're seeing her for her headaches, we're also trying to work on energy conservation with her increasing dysautonomia symptoms, especially as she is reaching puberty as well. We want to make sure that we can teach her some of these strategies. She has her accommodations at school, and we've worked through education on energy conservation, and she's getting better at learning her limits and when to push it. She's currently taking some electrolyte mixes throughout the day. She's working back into her regular extracurricular activities slowly, so she had to take a little break, and she's coming back into it to help work on the autonomic nervous system. We had a lot of conversation with the patient and also with the parents about different activities that she would like to participate in and what her limits might be in regards to her physical body and also energy expenditure right now. She does continue to work on balance with yoga throughout the week. If she's not able to get to her activities for the week, she does try to keep up some minimal treadmill walking for some activity. She'll ride her bike as a typical kid in the warmer weather a few times a month. She will be starting horseback riding lessons soon. She also participates in swimming, but she does this in alternating seasons so she doesn't get burnt out with it. It tends to build up anxiety the longer that she's in, especially swimming for her. So we've decided to rotate. And she's also found a local recreational gymnastics class that she participates in on a weekly basis that allows her to participate as she is able. So this is a very open gym, and they actually have specific classes for disabilities as well. She's in the regular class, the recreational class, but it comes with a lot of leniency in what she can do. So to wrap up this case, this particular patient had a number of visits to physical therapy for various issues that she's dealt with. She's been able to keep up activity by finding what works for her body and also keeping up some activities with her parents to encourage balance. She's really been working on energy conservation to recognize her limits and figure out the days that she can push it a bit and the days that she can't. She does attend physical therapy when something that she experiences causes fear or impacts her participation, or she's unable to work through it on her own after a week or so and it's still nagging, especially if something's feeling more intense in regards to pain. We encourage her to come in as soon as she can. She's had an incredible response to gentle visceral work for something we wouldn't typically think of referring someone to physical therapy for. This type of manual work is specific, however, and you would need to find a visceral practitioner in your area. But she's had great responses with her bladder issues to some gentle organ work. Her exercises overall are incorporated into her current activities, so she doesn't feel like she's doing too much or she does it in her chore time or schedule for the day. She does this with her head laser activity as it's after she finishes her chores, so it's just part of her daily routine. And some of her homework has turned into long-term things that she works on, like the leg balance that she continues to have minimal issues with. But she does incorporate this work into her gymnastics and yoga. Some of this work is hopefully temporary, such as the head laser that we're doing now, and she's probably going to be doing for a few weeks more at least as we work on this. But in the first few weeks that we did the head laser, the first week was actually the last week of school, she did actually notice an improvement in some of her symptoms with the headache by about 50%. The second week that we were doing the head laser, she was not in school anymore and just feeling better in general. So we do have to go over some more postural components with her for her school next year. But she's doing very well with the exercises that she's been given. She's had various types of physical therapy interventions for some of her conditions. I really feel her long-term progress has been in her finding a way to incorporate her physical therapy homework and exercises into her current activities and schedule, in the things that she likes to do. So hopefully you got to see a little bit of a presentation on a few different things and a few different physical therapy approaches, depending on who you might see and what specialties they might have, even for our children. And I just want to thank everybody for listening into this case presentation and for your participation in the summer conference this year. It's so much appreciated. Thank you.